All right, Rutabaga, thank you. Joining us now is the doctor who treated the first confirmed COVID-19 patient in the U.S., Dr. George Diaz. He is an infectious disease doctor who practices at Providence Regional Medical Center in Everett, Washington State. Doctor, thank you for being with us tonight. First of all, I just want to get your reaction to what we're hearing about these latest variants of the virus. So we've got one in Colorado, potentially two, one in California. And given what we know about what happened in the UK and in other countries, should this trigger a response from local, state, and federal government officials as to how we should be mitigating this latest strain?
Thank you for having me this evening. Yes, it's highly concerning that we have the strain here in the U.S., but it's not a surprise. This variant now comprises roughly 70% of the viral strains in the UK, meaning that over the last few months, it's really become the predominant virus in the UK. And it's also appears to be far more contagious. It has a number of mutations that make it easier to infect humans. And so it may be responsible in part for the surge they're seeing there. So we have found it in the US, and we will likely continue to find it. And it will probably, as in the UK, become a significant player in the U.S. in terms of infections.
I hear what you're saying about it is something that we expected. Dr. Fauci echoed that as well today. But I'm curious if months down the road we look back at this moment and go, well, we knew it was more contagious, so therefore by the sheer numbers, more people are potentially going to get it. Essentially, more people could die. Are we doing enough right now in this moment to address this?
I would say that it really varies quite a bit across the country. In some states, for example, the measures to mitigate this are very aggressive. In my state here in Washington State, the governor has been very proactive about closing down in restaurant eating and other measures that clearly have helped here locally. But unfortunately, in other states, the measures that are being employed are much more relaxed or non-existent, in which case this new variant certainly has the potential to really drive up infections in those places where compliance to these basic public health measures aren't being followed.
Dr. Diaz, why is it so much more contagious? What is it about this strain that makes it more transmissible? Is it in the air longer? Is it on surfaces longer? What makes it so much more spreadable, so to speak?
Yeah, it has three mutations which have not been seen in a new variant up until now. And these three mutations all basically work together to make it easier to infect human cells. And so they bind easier to the human cell, and then they also are able to enter the human cell much easier, making it much more contagious. And as a result, at least in the UK, they're seeing populations of patients becoming infected that they hadn't seen infected as much before, which is quite worrisome.
Doctor, we heard from the World Health Organization today, and they said that we don't have enough information to determine whether this new variant could undermine the vaccines. What are your thoughts about the current vaccine and how it will be able to manage this latest variant?
Yeah, so the current vaccine generates what we call polyclonal antibodies, meaning that our immune systems are able to form antibodies against multiple parts of the spike protein on the virus. And while this new variant does have a mutation that changes some elements of the spike protein, the part of the virus that causes infection to happen, those changes aren't sufficient to overcome all of the different antibodies that our bodies are able to make as a response to the vaccine. So we still believe that the vaccine will be effective against this new strain. And it's also encouraging that there have been reports that people with the original strain of COVID aren't getting reinfected with the new variant from the UK, meaning that those prior infections also resulted in polyclonal antibodies that have been able to control subsequent infection with the new variant. So we believe that the vaccine will continue to be effective and safe, and we certainly strongly encourage everyone to receive it when they have access to it.
Well, let's hope so this early on. Before I let you go, Doctor, we aren't hearing a whole lot about kids and the vaccine and the availability to a safe vaccine for our youth because they weren't involved in the trials. What can you tell us about a vaccine and the timetable for when that might be available for kids?
Yes, what you're alluding to is the fact that this UK variant appears to be infecting children more frequently in the UK. They've seen a substantial increase in infection in children, and thankfully it's not more deadly than the current strain, but it could make children a reservoir of infection for the entire community. So it will be very important for us to have access to the vaccine for children. I know those studies are ongoing now, and the current vaccine is available for those 16 and older when they have access to it. The sooner we get the vaccine approved for younger children, the better, because this virus is evolving, and one of the ways it's evolving is by being able to infect more people, including children.
Well, we certainly appreciate your time and your insight, Dr. George Diaz with Providence Regional Medical Center in Everett, Washington. Thank you again.